What is telemedicine and how does it work? Telemedicine refers to the use of technology to provide medical services to patients who are not physically present with the doctor. This allows people to receive medical care from a doctor who may be located far away. The use of telemedicine has been a subject of debate, and there have been technical limitations and other reasons that have prevented its widespread adoption. However, due to the COVID-19 pandemic, the government and the National Assembly temporarily allowed non-face-to-face medical consultations as regular patients were unable to visit hospitals due to the risk of infection. During this period, more than 130,000 prescriptions were issued, and there were only a few cases of misdiagnosis. Telemedicine is already used in many countries, and it is a question of whether South Korea should also adopt it. In favor of telemedicine, proponents position: it is important to introduce telemedicine as soon as possible to keep up with the convergence of medicine, biotechnology, and information and communication technology and to enhance medical competitiveness. Everyone should have access to high-quality medical services, but there are still people in our country who are unable to receive medical services. Despite the fact that Korea has world-class medical and information communication services, it is unacceptable that some people cannot access any medical help or services. Secondly, there is excessive fear that the remote medical service will result in misdiagnosis. In fact, there were almost no cases of misdiagnosis during the COVID-19 period, and telemedicine is being implemented in many other countries around the world. Korea is known to have top-class information and communication technology, and giving up telemedicine service is the same as giving up on the future of this industry. With the combination of information communication technology and medicine, the market of U-Health is continuously growing. Furthermore, the fear of misdiagnosis can be addressed through the development of technology and appropriate policies. Instead of allowing telemedicine in all types of diseases, it can be allowed in certain diseases to start can be a solution. However, opposition to telemedicine services will result in significant losses for both the country and the individuals. Telemedicine should not be allowed. Opposing view: we should not allow telemedicine treatment because humans' life is the most important right. Firstly, there is a high possibility of misdiagnosis with telemedicine. During the COVID-19 pandemic, there were almost no cases of misdiagnosis with telemedicine because most of the people who received telemedicine had the same disease, which was COVID-19. Also, the people who chose to receive telemedicine instead of going to the emergency room were because they were not seriously ill with COVID-19 symptoms. Just because telemedicine was successful during COVID-19 does not mean that the possibility of misdiagnosis will disappear. Accurate and appropriate diagnosis is essential for treating any types of disease, and face-to-face treatment are necessary to guarantee the health and life rights of the citizens. Furthermore, if we allow telemedicine, a structure can be created where university hospitals monopolize medical services. In Korea, people already tend to prefer larger hospitals over smaller ones. If telemedicine is introduced, more people will likely choose to go to larger hospitals, which could lead to a collapse of primary care services provided by local hospitals. This could ultimately result in a decline in people's access to medical care. Telemedicine is seen as a system that primarily emphasizes convenience, and it may be difficult to implement in Korea's medical structure.